So, Dr. Doug Abbott, thank you so much for coming on. I've got so many questions, and my knee replacement support group has a ton of questions that they send in to me ahead of time. But before we jump into it, could you just take a couple moments and kind of take us through the background? So the people who don't know you, Dr. Abbott is an orthopedic surgeon, but tell us a little bit about what got you into medicine in the first place, and what was the road to getting to where you are today?
Sure, Tony. I really thank you for having me today. This is an awesome opportunity to be able to speak, in a virtual way to patients who really need information, and sometimes they don't always feel like they get it necessarily within the office setting, although I'm sure their physician would love to provide it for them. So I think this is just a great platform and a way to reach patients even better. What got me started into medicine? I started thinking I was going to be a primary care physician when I was in high school, and went through college thinking that until I went to medical school. Finally, as I was going through medical school, we do clerkship rotations where we rotate in the various disciplines, and my wife found that I came home happiest after going in for my orthopedic rotation. And it was really an opportunity where I could take a patient's problem and use my hands and knowledge to solve it, versus just either pushing pills or doing different things that we kind of tie to conventional medicine at times. So I love the opportunity to take a patient from a point of their life where they're not doing well, they're not able to do the things that they want to do on a daily basis, and their disability, for lack of a better word, is limiting them. And to be able to enable them through either non-operative treatment first, followed by those that really need surgery, getting them the right surgery at the right time to enable them to get on with their life and to do what they want to do. And in essence, that's why I do what I do every day. It's a great joy to see patients who sometimes are even in wheelchairs coming in, and several weeks later they're coming in walking. So it really
Wow.
feels good to be able to do that for patients, and I'm just humbled and blessed to be able to play my part.
That's so true. And let me ask you, I've always considered you kind of a lower extremity expert, but do you categorize yourself as a specialist in anything, or how would you define yourself?
Sure. In my training, so I did my surgical residency at the University of Louisville in orthopedics, and I stayed on there for an extra year doing a sports medicine fellowship, actually, and did a lot of cartilage restoration, ACL reconstructions, and started into some partial knee arthroplasties with that. Also, just in my general orthopedic training, had a very good experience with our joint replacement specialists, really multiple ones at the University of Louisville. So coming out, joining my first group, which was actually up in Middletown, the first 6 years of my practice, I did approximately 50% sports medicine, and maybe 20% was joint replacements, and the rest were trauma cases, patients with fractures and so forth. And yes, I would say hip, knee are probably my wheelhouse. I do a fair amount of shoulder work as well as arthroscopy, rotator cuff repairs. So really the big three joints when we talk about orthopedics. Foot and ankle specialty things, I usually refer those on to some other partners, but certainly have a broad background in sports. But that's what got me more interested as I aged and my patients aged. I saw more patients that needed joint replacements,
Yeah.
and with my current practice, that was the niche that needed filled the most. I've been working out of Mercy Fairfield location now for the last 5 going on 6 years, and probably to about 240 joint replacements a year. So by volume standards across the area, I think I'm probably somewhere in the teens as far as the total number of docs. There are certainly busier doctors than me. I still like to have a human approach to my patients and know them, know what their goals are. So try to avoid as much as I can becoming a sort of a factory for joint replacement, but at the same time providing excellent care and rehabilitation. So.